Next page, ma'am.
I'm restarting, okay? Yes, you can start.
Okay. Hello, I'm Dr. Sindhu, one of the doctors here in the gynecology clinic today. Can I confirm your name and age?
I'm John. I'm 33-year-old.
How do you want me to call you?
John is fine.
John, I have gathered from the letter that you are trying to have a baby since 2 years and you have done certain reports and you are here to discuss the reports, right?
Yes.
Any other concerns and expectations?
I just wanted to know what are my reports are saying.
Yeah, well, John, I would be explaining that in a while. Before that, as we are meeting for the first time, is it okay if I can ask you a few questions?
Yeah.
And let me assure you, like whatever we speak here would be confidential, and some of my questions might sound intrusive. Is it okay to proceed with?
Yes.
Well, could you tell me in detail about your concerns?
Doctor, actually, we have been married since last 4 years, and we are planning to have a baby since last 2 years.
Mhm,
6 weeks back, the GP has referred me to the consultant. We were together at that time, and the GP has advised certain
mhm,
investigations. And I hope
mhm.
you are aware about my case details.
Yes, yes, I'm aware of your details. I'll be explaining that in a while. And could you tell me about your sexual life? Like, have you or your partner been treated for any sexually shared infection before?
Uh, yeah, actually, when I was young at that time, I have been treated
Mm-hmm.
once.
Okay, okay, fine. Were you using any contraception any time before?
I was using condom.
Yeah, it is very effective in preventing sexually shared infection. I really appreciate that. Can I know, like, what is the frequency of intercourse?
Yeah, I do have sexual intercourse quite regularly.
Mm-hmm. Are you aware of timed intercourse?
Oh yeah, I'm aware about fertility window, and
Mm-hmm.
my partner's periods are pretty normal. So we do generally have the intercourse around the time of ovulation.
Okay. So, any other partners you had any time before?
A long back, I told you I had a partner. I was involved with certain uh,
Uh-huh. Okay.
partners, and with that, actually, I had this sexually transmitted infection, which was treated at that time.
Okay. All right. Have you fathered any child before?
No,
Mm-hmm. Okay. So, I can see that Andrea, your partner, she has a 6-year-old child, right, from his previous partner. Can I know, like, what was the mode of her delivery?
I think she has delivered normally. There wasn't any concern at that time.
Right. So, does she has any medical or surgical comorbidities?
So far as no.
Is she otherwise fit and fine?
Yeah.
Mm-hmm. Well, can I know, like, do you have any medical condition? Before that, can I know, like, did you ever had any childhood infections like mumps?
No.
Mm-hmm. Or any weight loss or weight gain?
No.
Any recent change in the shiving pattern?
No.
Okay. So, any blurring or head blurring of vision or headache?
No.
Okay, so can I know, like, are you visiting GP for any medical conditions like either sugars or raised BP or thyroid?
No, never.
Well, have you underwent any surgeries on your groin or down below, like either hernia or hydrocele?
No, never.
Any trauma down below,
No,
anytime?
no,
Okay. Have you received any kind of cancer treatment like chemotherapies or radiotherapy? This is not to scare you, but just to get an information to know you
no,
better.
no.
Well, can I know your weight height ratio?
I think it's normal.
Okay. Any allergy to any drugs
No.
or food? All right. Some personal questions. Do you or your partner smoke or take alcohol?
Yeah, I do smoke. I do smoke 5 to 6 cigarettes a day.
Any thoughts of quitting?
Uh, yeah, actually, the GP explained us about smoking and its effect. I'm planning.
If you wish so, I can connect you to the NHS stop smoking services. Will that be okay?
Yeah.
Okay.
Yes.
Yeah. Pardon me, any recreational drugs?
No.
Okay. Is there any significant family history, like any genetic conditions like cystic fibrosis or any blockage of tubes?
No.
Okay. And otherwise, do you consider yourself to be a happy couple?
Oh yeah, we are actually happy couple and we are looking forward to a baby.
That's good to hear. And can I know what do you do for your living?
I am engineer.
hmm I know trying for a pregnancy is quite stressful. And have you ever felt low or depressed in the past couple of days or weeks?
No. I'm
Well, thank you
just
for that. Yeah, yeah.
anxious. I'm just anxious, getting anxious more and more because I wanted to have a baby.
You're anxious is really appreciate. I know that you're very much anxious. We'll definitely be addressing that in a while. It is understandable. And any other information do you want to add?
No, doctor, I just wanted to know what are there in my reports.
Well, thank you for the information. And I could also see from the notes that the Andrea's quite report were missing, right? And I'm really sorry about that. We should look into the matter, and we'll see why this has happened. Okay. And anyhow, we have got some prints of the notes. Okay.
Okay.
All right. So coming to your concerns, I do have your reports with me. Have your partner's report as well, but we would not be able to discuss your partner's report. Do you have any permission, written permission from her?
Yeah. You can go ahead.
You have a written permission?
Yeah, you can go ahead.
Yeah. Okay. So first, coming to your reports, do you want somebody to be with you
No,
while I
doctor.
discuss the reports?
No,
Yeah.
it's okay.
Yeah. I have
It's okay.
confirmed the name. Yeah. Well, has anybody discussed the report with you till now?
No.
Okay. Is this your first sample to confirm with?
Yes.
All right. So I have confirmed the name, age as well as the NHS number. John, in your semen analysis report, it shows that there are no sperms available. There are no sperms seen. I'm really sorry to be the bearer of this news.
What, doctor? What does that
Yeah,
mean?
yeah, John, I know you're anxious is understandable, but this is the first sample, but we need to we need to repeat the sample again in order to confirm the diagnosis. So in the present sample, we are not able to see the sperms. Can I know like why where the 2 to 3 days of abstinence was followed,
Yeah, doctor.
and was it given immediately for testing?
Yes.
Yes, John. I know this would have come as a shocking news to you, but we do have to repeat the sample again to confirm the diagnosis. John, like there could be some causes like either the infection or increased weight to height ratio, or because of some infections like mumps, or sometimes because of congenital absence of the duct, which helps in the bringing out the sperms outside, and some genetic abnormalities. There are so many causes, John, but it is difficult to pinpoint what is the cause right now. So we do have to evaluate you further by repeating the sample and other investigations as well. Am I clear so far, John?
Okay. What kind of investigations you are going to offer me, doctor?
Like we would have to do your hormone test, like testosterone, which is not available here right now, and your FSH and LH, which are all the brain stimulating hormones, and as a sugar test as well as your thyroid hormones. And we might also need your scanning of the groin down below the scrotum,
Hmm.
and some genetic testing as well. All right.
Okay.
Okay, so John, can I proceed with the management?
Yeah, doctor, I would definitely like to know management. Will I able to have babies?
Yeah, John, your care will be under a team of doctors. That is my consultant, the male fertility specialist who will take care of this conditions. Okay, and the counselors, the support groups, and also I'll write back to the GP as well. So here, very importantly, we'll do the repeat the test, and I'll be referring you to the specialist doctor, that is male fertility specialist doctor, who would be examining you and would also do a special scanning to see. And also, there is something called as needle test to know whether there is actually real blockage or not, and also to find out the other causes of that as well. All right.
Okay.
And there are some lifestyle modifications like having a healthy diet, exercises, and stop smoking and alcohol. And also, doing this can also definitely help in improving your sperms as well.
Okay, so is there any chance of me getting baby? Then what are
Well,
my
yeah.
options?
Yeah, well, John, we do again have a two option depending upon your sperm count. If at all, if it comes to be the same report, then we'll be referring you to the specialist doctor who'll be doing a needle test and aspirating the sperms. So, depending upon the sperm count, the sperm would be directly injected into the eggs of your partner, and we would do an IVF, which is called as ICSI, which would be transferred into your wife's womb. Okay, for further continuation of pregnancy.
Okay, and whether I will be eligible for this treatment on NHS?
Yeah, John, actually, it is very difficult because your partner already has one kid. So it has to be a self funded one. And if so, in your case, I can also write back to your GP and we can continue through the clinical commission group as well to know further about this. But it might not be criteria fulfilled in NHS, John.
Okay.
Anything else?
Yeah, I'm really
Okay.
disappointed.
So I'm so sorry to be the bearer of this news. I think we can meet you as a couple for further discussion if you have any doubts along with your partner. I shall document everything, give you a written information leaflet. I shall fix another appointment as well. I shall connect you with the support groups and the counselors, John. I know it is quite stressful. And I'll be arranging another test for you. Okay? Immediately, I shall ask my nurse to do that. All right?
Okay. Yeah, thank you.
Thank you.
Okay, so your feedback, I'm not asking completed.
Yes, ma'am. I didn't
Oh,
explain the partner's report.
yes, you missed out on that. Since we are lacking on that running battery pattern, only points which I wanted to tell you. Missing case details, it is always better that you should be apologized in the beginning because that is clinical governance issue. Okay, clinical governance issue, if not been addressed, then it is patient safety point. Okay, that one point, it is better off if you could have addressed in the beginning. Steroid, you missed out. It could be excessive weight loss, weight gains, gymming excessive, and steroid, that is another issue. Okay, in the RCOG pattern, this is most of the time associated with linked with steroid and azoospermia. So
Okay.
always,
Okay.
that is one thing that has been missed out in the history taking. Okay, then you checked consent was there, confidentiality was assured, but then you didn't explain, as you rightly said, that you didn't explain with the partner's report. Another
Yeah.
thing, since you know that you were running out of time, there is no need to ask partner details as per my. Yeah. Okay. Although in the role players instruction they had given so much about the partner, but male infertility, urogyne, these are the big tasks where you have to evaluate maximum history. So here your history will not be completed within 3.5 or 3.30 second or 3.50 second. It will almost take 4.30 second or 4.50 second. So see to it your history should be completed by that time, and it should be very precise and fast. Hmm? Because of that, the history completed by 6 minutes. That's the reason you
Yeah.
couldn't ask me any concerns. You means in the beginning you asked me concerns, but then there were multiple concerns which I
Okay.
only put it down because I wanted you to complete the task. So that is one thing.
Mhm.
Uh, uh, this is this is what you have done. Okay. Then the management, you had complete at least able to cover up maximum management within that stipulated time, but you need to label this condition. What is this condition? BBN was not formulated properly. You need to formulate your BBN template very properly. First shot was not
Okay,
given.
ma'am.
Directly you bombarded with me that no sperm is given. So BBM needs to be formulated properly. Repeat sample very good. Abstinence very good. Draw. Whenever you wanted to explain something, it's always better if you will be drawing. The lay examiner will at least able to score you more. Huh? Uh, okay, so at least draw. And this is what is this? What is a diagnosis?
Azoospermia.
Yeah. So did you
Yeah, ma'am.
mention? Okay.
Oh, ma'am, I missed.
Establish the issue involved in the manage. Explain the likely cause of couple subfertility. So this is azoospermia, a male factor infertility. Most likely, looking at the partner's report, things are set, things are normal with her partner, with his partner. Hmm? And then
Yes.
management, yes, not only IVF ICSI, there are alternative managements. Would you like to discuss that? The many a times people would like to discuss alternative management, something like adoption or fostering or donor IUI. Yes or no?
Ma'am.
Because IVF ICSI, he will not be funded. It will be a private affair for him and it will be a costly affair. So those options also we
Mm-hmm.
need to discuss sensitively. Okay,
Yes,
because
ma'am.
see, yes, we cannot explain only one thing here. We need to explain all the things with a sensitive approach. If you directly say that okay, you are having three options. One is IVF ICSI, second is donor IUI, and third is adoption or fostering. Then he might not like it. You need to tell him IVF ICSI. But it will not be funded on NHS. He has to go for a private funding. It will be a costly affair, and to avoid
Mm-hmm.
all these things, if he wish, we can discuss alternative, take a permission before discussing, and that will be fostering adoption or donor IUI. Okay, so this is what actually
Okay.
the only few points were missed out. Rest of the things were completely means mentioned very nicely. Okay, so my concerns are: can we have a IVF on NHS? How you are going to formulate? So one test you missed out. Andrology, you missed out. Andrologist, we are not going to refer him to a male fertility expert. It is an andrologist or a urogynecologist who will be examining him, and we are going to, after that, once the testing examination has been confirmed, then he will be referred to the fertility expert. And there is nothing like male fertility expert. It is an andrologist or urologist.
So, apart from male infertility specialist, we have to say urologist, ma'am.
See, male, this azoospermia and all those things comes under andrologist purview. So the
But how
andrologist
to
will
express
be,
the patient? We'll refer you to andrologist, ma'am.
yes, we can say that a male doctor, andrologist, you can at least take a urogynecologist who will be examining you. And fertility specialist
Mm-hmm.
are different doctor. Okay. Don't mix
Mm-hmm.
this.
Okay.
It might
Okay,
not
ma'am.
be giving you, means if you wanted to say that you wanted to explain a andrologist, but it might not be giving you marks here. Hmm? So that don't try
Okay,
to
ma'am.
confuse, don't try to make it okay. So specifically take a name, because communication with, here all the domains are being marked. You have, see, all the domains has been marked. Okay, so communication with colleague. So andrologist is a part of a team. Hmm? So
Okay, ma'am.
introduction was good. Situational awareness in the beginning you missed out. That is missing case detail. Aim setting agenda was very good. Confidentiality you assured me. You signposted me very good. Okay, so these are the, see, your, what was your negative in this whole task will be time management. If you
Yes,
will
ma'am.
work on that, these are small points which you had missed out. If you will work on that, because after 4 or 5 minutes you were just reading in the real exam, nobody will give you that time, that much time. You have to read it quickly, you have to grasp that information very quickly, and you have to enter into your station very quickly. Time management including your history taking is very important. See, the RCOG exam is not only about practicing, it is giving your eyes a ability to interpret information as fast as possible. Not in first, second, third station, but continuously for the 14th station. Okay?
Yes,
It
ma'am.
is the exam of mind game. They try to play a mind game with us. In the initial half, we will be very attentive, we will be interpreting. As exam progresses, in one or two tasks, our mind will give up and we will not be able to interpret the information whatever they had given it to us. Okay?
Ma'am.
Yeah. Now, so that was done very nicely. Then you asked me, Miss, my first question is, tell me in detail about your concerns. Okay, tell me in detail about your problem. Yes, married, wanted to have baby since 2 years. Have you been investigated? No. GP, then GP has asked me to see the consultant, and then he has arranged, and I'm here to discuss all the reports. Okay, so that fertility window, having regular intercourse, that has been very nicely. So the history was complete, almost history was complete. That steroid, because if it is in the real exam, it's a steroid induced oligo or azoospermia, then you will not score the marks. That's the reason I have pinpointed it, that you ask any supplementation, any gym supplementation, any protein supplementation or steroid, whether you are taking or not. Then shaving frequency, body hair, loss of desire is another point which you had to ask. Father, you acknowledge partner is having mother. Recent body weight changes, trauma, any recent infection you missed out, but it's okay. Mumps, chemotherapy, radiotherapy, uh, any other medical condition you asked me. Okay. uh, Surgical history you asked me in detail, family history of cystic fibrosis you asked me. Acknowledge the information, so engineer was given, you do not need to ask, so you are engineer by profession, you could have acknowledged. Occupation acknowledgement is important. Then smoking, alcohol, and you had guided me for NHS quit smoking services. Very good. BMI is normal. Steroid supplementation or any supplements for bodybuilding is important. And looking at the partner, you could have skipped out. Means I will say, since you know that multiple things are there and the partner's reports are normal, I would have skipped out everything. Okay, that fertility window, because everything is normal. So tubes are normal, ovulation is normal. Okay, sexual history is normal, so you can skip out because it's a lengthy station according to me.
Okay.
Always check whether he's aware about the report or not. Always check, and then discuss the reports one by one. Always normal first, followed by abnormal. So you can just quickly, in one line, you could have said that I'm having your partner's report, or Andrea's report, which shows that her hormonal profile is normal. She is releasing eggs, and her tubes are patent. One line, so finish it off. Then big format you need to follow. First shot, I'm having a.
Hello.
Hello, am I audible?
Yeah,
Yes,
ma'am,
ma'am.
can I interrupt regarding the report of partner? Should we speak about the report if she is not present here?
Yes. So she has asked, okay, so she has asked the consent. If the partner has given consent to discuss the report, then we can discuss the report. If the patient has given consent, and if he's saying that yes, she has consented, then you can discuss the report.
So that
It
is
is.
only the verbal
Madam, is the
consent, like
written
if
consent is important? See, it was actually what has happened in my exam also. I asked them about written consent, then the role player was very angry, annoyed, and she said, when I told you, yes, I'm having her written consent or his written consent. Okay.
Okay.
So if you say that, do you have any written consent? And if she says yes, you have to believe. I said, show me.
Okay.
So she was very angry with that.
Okay.
So you just need to believe. If she says that,
Okay.
okay, then you just explain.
Okay, okay. So we will ask that written consent, like whenever we are asking, right?
Yeah, it's always better. Do you have any written consent or written permissions? So that
Okay, okay. Thank
you
you,
are
thank you.
safe from your
Okay.
side. Okay. Then releasing eggs, normal tubes, normal hormonal profile. So she is normal, and her age is also 30. Uh, then abnormal. Okay, so you have to ask whether, and very nicely you asked whether it was collected properly and processed very fast. The condition when we do not see the sperm in the semen is known as azoospermia. Have you heard about this condition? That is checking a knowledge about azoospermia, because this gives you mark, dear. That is a diagnosis what you are going to give it to your role player or your examiner. So this is knowledge.
Okay.
It is a azoospermia. Okay. Very nicely you mentioned that you need to confirm by doing a second report. Okay. Then
Yes.
ask his permission to continue further. Take a pause. Take a pause. Whenever it is BBN, take a pause. Difficult news, counselor is very important. You have offered me counselor. Yes, means this is my one sentence what I used in subfertility task. 1 out of 7 couple find it difficult to conceive naturally. With modern techniques, with newer treatment options, yes, one can enjoy parenthood. So do you want to discuss further? So draw why the sperm count is less. So this that was my one of the concern. So you can draw here. So a signaling from brain, a production in the testes, or your outlet, that is a transport. Anywhere, any abnormality, in simple language, you can just tell her. Any simple abnormality can lead to decreased or absent sperm. Okay. Yeah. So in your case, the more probable reason could be, looking at your history, it's chlamydia, which might have blocked the tubes. Then he will start blaming. Oh, see, so just tell him that we do have come across, but not means this might be a reason, but we need to evaluate you completely by doing certain tests. And for that, I will be referring you to a male doctor known as andrologist. I will use this terminology. Okay. He will be examining you. He will be doing ultrasonography of your testes and will run some test to see your hormonal profile like FSH, thyroid, testosterone, and will offer you tissue biopsy along with karyotyping. With tissue biopsy, here the catch is very important here. If the tissue biopsy and karyotyping is reports are normal and we could able to find out the sperm inside the testes, then there will be an option. So the option will be the team of experts come up, gynecologist, andrologist, male doctor or male doctor, counselor, fertility specialist, and then we will discuss about a IVF ICSI. That is a procedure what you had very nicely you had explained, that the sperm will be taken from your testes and then they will be injected in your means it will be IVF, that means test tube baby. It will be fertilized with your partner's egg and then they will be put it back into your wife's womb. Okay, so the procedure is known as IVF ICSI. There is one question regarding TESA PESA, that is the techniques by which we will retrieve the sperms. Okay, so TESA
Yes,
is
ma'am.
testicular and PESA is percutaneous.
What, ma'am? Tessa?
Is testicular extraction of sperm and PESA
Okay,
is
ma'am.
percutaneous extraction of sperm. Okay, so that is a technique. Okay, so these are technological terms. Here this is a technique. Now this is an option which is available. If he will ask, most of the time he will ask, but if not asked, then you just tell him very sensitively, since means there are certain criteria to accept this treatment on NHS, and I'm really sorry, you might not fulfill those criteria since your partner is having a kid from previous relationship. Privately, so you can go for a privately funded, but it is costly. The cost of this treatment will be very high. So if you wish, we can discuss alternatives like donor insemination and adoption. Okay, so this is too much to take on right now. So shall I share with you a patient information leaflet regarding azoospermia, oligospermia? There are certain males, fertility UK network people with whom you can discuss, a counselor, you can discuss with your wife also. Before going for any investigation, that means IVF ICSI, we will also like to test your blood for certain blood tests like HIV, HBsAg, and syphilis, HCV. Okay.
Yes, ma'am.
Mm. Now, this is not a GP and the CCG, it is an integrated care board. Okay, integrated care board who will be who will be deciding on IVF and ICSI. So with that, as of now, we are going to send you to an andrologist or a male doctor. And once those techniques, those reference has been done, we can see in the presence of your partner and my consultant, we can continue with the further option and discussion. Okay. So this way you can close the task. Domain-wise scoring actually, obtain appropriate fertility-focused history, exploring fear and concerns. You need to identify the cause of blockage. Okay, that could be SSTI. So you need to at least say something that could be a probable cause, but we need to find out the reason. Obtain specific information relevant to azoospermia. So that history taking was normal here. Sexual history, steroid, and loss of libido. This is my red points. it needs to be asked. Okay, star points. Whatever interpretation investigation has been given, you have to interpret correctly. So you had missed out on this. Reassurance, basically you just need to give him that reassurance basically regarding the missing case notes, and appropriate things will be taken care. Okay, uh, means not to miss out on that. So that clinical governance part is also important point here. We will see to it that in future we will means we will have your case details, and if not find it out, we will raise incident report. See here, I have mentioned this. Okay, yes. So this is
Yes, ma'am.
information gathering. Communication with patient, I really like the way you communicated. There were not any means harming sentences, blaming sentences, so it was a very good communication from your side. You need to explain the possible reason for azoospermia, that is communication. You have to encourage me, you have to come out with my own fears, because you were not having time, so you couldn't communicate with me in that way. Empathetic, you are empathetic, sympathetic. Okay, so all those points were very nice. Then you had recommended me karyotyping, but you have not recommended me testicular biopsy. Then a recommendation is ICSI plus PESA TESA. IV, self-funded IVF will be an option, and then PIL and support group, that is an alternative. Uh, Communication here, yes, urologist or andrologist. Reproductive medicine, lies with clinical psychologist or nurse counselor, you mentioned. Fertility specialist for ICSI IVF. Clinical commissioning group or ICB. Now we will be saying ICB. But in this case, ICB will not play a role, because as a clinician, we know that he or she will not be eligible for the funding. Presents the pros and cons of the proposed management, limits of their clinical abilities, governance. Okay, so patient safety, basically you just need to explain the pros and cons of proposed management, which when you are going to involve whom. Okay, clinical governance, permission. Okay, so consenting is important whenever you are wanted to discuss Andrea's report. Apology for missing case detail, which you had not offered. Assure confidentiality, which you offered. No false hope. IVF funding not eligible. Clearly, you have to mention that. Then advise investigations to check for other sexually transmitted infection. That means HIV, HBS, HGV, okay, HCV. Genetic problem, welfare of upcoming babies, signposting and assessing whether there are any signposting. You signposted lifestyle advices. Okay, cutting down on alcohol and steroid, not steroid here. It is smoking. Repeat HSA, sample collection appropriately, psychosexual counseling or counselor, NHS funding, steroid history. Okay, so most of the point in patient safety you could have able to cover up. So information gathering, I will not give you complete full on full, but most patient safety and communication with patient colleague also I will give you full on. Okay. Different causes of azoospermia. You have to identify that if this is azoospermia. Unless and until you will not say azoospermia, you may not be getting your marks. Okay, so always identify that this is what is this condition, and how you are going to manage this condition is all about. Okay, and this is something regarding the resources. There are multiple resources available. Him fertility campaign. This is the website for this male infertility. So you can take a name of that. Infertility support and events. This is another support group. Multiple information will be available on this site, uh, but overall very nicely done by you. Thank you. Okay, any feedback, any questions?
Thank you, ma'am.
Okay.
Hello, madam. Actually,
Yes.
sorry, I'm new here. I just wanted to ask if we can also get the recording because I want to write all the points that you have mentioned.
Actually, I am on the different computer or different laptop. I will check whether my computer has been is recording it or not. May not be possible this time. I will just check and come back. Okay, 1 minute.
Okay. It is showing that someone started recording, so I think it is being recorded. If possible, madam, just if you can share.